ABO blood group. A blood group consists of, so definitely both are having H antigen. A blood group has amine, galactosamine, and B blood group has galactose. Lymphoplasmacytic lymphoma is actually non-Hodgkin's lymphoma. So it is Waldenstrom's macroglobulinemia. It is a B cell neoplasm. Primary effusion lymphoma. It is, so already there is E. So the whereas primary CNS lymphoma, no E. So just cross it. Primary CNS lymphoma is caused by E, Epstein-Barr virus. Primary effusion lymphoma is caused by HHV, Kaposi sarcoma virus, HHV8. Peripartum cardiomyopathy occurs 1 month before labor, last 1 month or rest of the 5 months after delivery. Ejection fraction is low ejection fraction, less than 40%, 40-45, and it occurs during S. Hepatitis C is related to mainly MPGN, MGN and MPGN. Then next BP normal. The classification is like normal, elevated, grade 1, grade 2. Elevated means 120 to 130. 130 to 140. So initially difference in 10, then difference in 20. So 120 to 130 difference in 10, then grade 1 130 plus 20 150, grade 2 plus 20 170. Then next Budd-Chiari syndrome, hepatic venography, correction of hypothermia, coagulopathy, acidosis in stage 2 phase, primary hydrocele, there will be excess defective reabsorption, secondary hydrocele excess production, preoperative chemoradiation plus surgery we do only when from T3 onwards. That is muscularis propria involvement. Glasgow-Blatchford's cure, that is whether to do medical intervention or some surgical intervention. Forrester's classification based on the endoscopy. Rocka's risk of pre-bleeding. Respiratory trauma scores including respiratory rate, GCS, and shock, that is BP. So respiratory trauma score, the component of that is Glasgow Coma Scale is a component of respiratory trauma score, and respiratory trauma score is a component of TRIS. One more score, injury severity score, and you can see IRMA is the mnemonic for that. So I told injury severity score, R is respiratory trauma score, mechanism of injury H, then mangled extremity severity score MES, the mnemonic is ELISA, extent, limb ischemia, shock H, extent of injury, energy. NIHAS classification, NIHAS you have to remember indirect, either ring is normal or ring is dilated, 1, 2, 3 DIF, 4 is DIFC, recurrent hernia. OPSI occur 2 to 3 years after splenectomy. Femoral nervous posterior division of L2, L3, L4. Bell's nerve, you remember belt is the mnemonic. So bell comes first, T. Thoracodorsal comes later, C5, C6, C7, C6, C7, C8. Ejaculatory duct, urethra. Ejaculatory duct is opening into, so Bell's nerve, okay, then ejaculatory duct is opening into which, into the central zone, whereas transitional zone you have urethra, that is BPH. Heterochromatin, euchromatin, U, loose, that is lightly stained, and heterochromatin tightly packed, so darkly stained. The next, anterior pituitary develops from surface ectoderm, posterior pituitary neuroectoderm. Genu consists of corticonuclear and superior thalamic radiation. Apnea caused by succinylcholine, it can be either because of, either you are giving normal dose but there was deficiency of acetylcholinesterase leading to apnea, or it can be because of more dose given. So in the question it can be given like more dose, higher amount, or it can be given continuously, it was given intermittent episodes, it was given. That means the dose is elevated, so it will lead to phase 2 blockade and leading to apnea. Order of susceptibility of nerve fibers to, so three things you have to remember: pressure, hypoxia, local anesthesia. Pressure A more than B more than C, and whereas in local anesthesia it is B more than C more than A. In hypoxia, B more than C more than A. Local anesthesia, C more than B more than A. Stage of surgical anesthesia means stage 3, automated respiration to respiratory paralysis. Final center for horizontal movement of eye. It is actually lateral rectus. It begins from medial rectus, then same side MLF, then cross PPRF, then lateral rectus. Depolarizing cells is amacrine cells. They are actually forming the limiting membrane. Senile entropion surgeries are Jacqueline, then mnemonic. So Jones, Cookert and Weiss operation. Mattress suture. In the number A, you can see it's horizontal. So the answer is vertical mattress suture. In B, it is vertically, you can see the line. So it is horizontal mattress suture. That's how you can remember. Marker for Paget cells is CEA. Neck injuries zones, you can remember the mnemonic CMS. From cricoid to mandible, mandible to skull, in that order. So sorry, the mnemonic is wrong. So it's from thoracic cartilage to cricoid, cricoid to mandible, and above the mandible. It's like that. From thoracic inlet, it has to start. So you have to change the mnemonic. TCM. Then branchial cyst relation. Branchial cyst, it's actually lined by squamous epithelium. It's above upper you have digastric muscle, and below you have this nerves like hypoglossal nerve. Appetite is decreased. Why? Hormones are meals. Milk, you can remember milk, MILC, MSH, insulin, leptin, corticotropin releasing hormone, CCK, all this. Then GPCR in inactive form, alpha, beta, gamma, they are together. GDP will be there binding to them, all of this. Whereas if it's active, something has bind to ligand binded, then GDP becomes GTP and elope away with alpha. Means alpha and GTP will be separated. Intrapleural pressure, or mostly it is negative in most of the case. Relaxation of mesangial cells, mnemonic is DANCE, dopamine, ANP, cyclic AMP, and PGE2, prostaglandins, causing relaxation of mesangial cells. T regulatory cells, they are CD4 cells. They are actually needed for preventing autoimmunity. FOXP3 is the main marker. So if there is defective, autoimmune disorder occurs. Romana sign is seen in Chagas disease. Positive catalase and bacitracin test. So this question is confusing at the first view. Like bacitracin test positive, you think about pyogenes, whereas catalase, you think about the staph. So when both comes positive, it is micrococcus. Corynebacterium diphtheria gravis intermedius mitis, gravis medusa head, intermedius and mitis. Intermedius is frog egg. CF is near to I, EFGHI. MNOP, poached egg. Mitis is poached egg. Vascular nodules in immunodeficient, that is Bartonella, henselae causing bacillary angiomatosis. Vascular nodules, so angiomatosis. Bartonella is causing that. Narrowest segment of facial nerve is labyrinthine. Bony septal perforation is seen in bonsai. You can remember the mnemonic bonsai, syphilis. Dash attains adult size before birth. Ossicles. Tripod fracture in zygomatic arch. First pharyngeal pouch giving rise to this tympanic cavity, middle ear cavity, eustachian tube, all that. Okay. So stay tuned for more questions